Hey guys, it is Dr. Kre, and thank you for joining us for the latest edition of the Dr. Kre and Me show. Come on in the room, and we will talk today about the latest symptoms of the coronavirus. Of course, we've been doing this every single week, having the show and talking about something new that I feel like you guys need to know about. And so today is no different. I will be sharing a few jewels with you guys as we chat today. So when you get here, let us know where you are watching from, and we'll talk about some new symptoms that have evolved about the coronavirus. And make sure to share and to like the page. Share again. Share. And we're going to have some fun today. I promise, guys, I won't hold you long. Again, it is Dr. Kre. I am your board certified family medicine physician, and I specialize in helping everyday working people who are just overwhelmed. You may not be working now, but I know you can't wait to get back to work now, right? You have a new appreciation for those things. Anyway, I help everyday people just learn about their lives, learn about what's going on in healthcare right now. Currently, that topic is the coronavirus, and we want you to live healthy, happier, whole lives, okay? So today I wanted to jump in and talk about some newer symptoms that we're starting to see with the coronavirus. Remember that we talked about some weeks ago that, hey, coronavirus is a virus that is been known for some years and years and years. This particular virus is COVID-19, and we are seeing that it is different than the virus of years ago. The current coronavirus, this is a mutated form, a different form. It is a much more mutated and just scarier form of virus. So remember, we talked about having a fever greater than 100.4, having a cough that's different than your normal allergies, than your normal sinuses, shortness of breath, wheezing, fatigue. So up until this point, we really felt like that's the mainstay of the symptoms, right? Well, I want you to write in the post, if you can, that, hey, you can have problems with GI. So you can still have that a low-grade fever. Some people report anywhere from 99 and up. And they have this watery, diffuse diarrhea just running through you, right? So that can be a symptom of the coronavirus. Don't just chalk it up to food poisoning. Don't just chalk it up to I had something bad, or I just may have a regular virus. It very much so may not be a regular virus, okay? So number one, you can have those respiratory symptoms, that being a cough, the shortness of breath, that being the cough, shortness of breath, wheezing, those symptoms. But you also can have problems with your GI tract, that being just diffuse, watery diarrhea. Everything you eat comes through you, or you don't feel like eating, right? You don't feel like eating at all, and that runs straight through you, okay? So you have some GI symptoms and you've not been eating anything different, you've not been eating out, and everything is straight water, then that could be a sign of the coronavirus. So number 3, you can have a change in your sense of smell. So you would say, hey, everybody's like, it smells like a rotten egg in here. And you're the only person in the room that cannot smell the rotten egg. Then it's a good chance that you yourself may have coronavirus symptoms. So the change in smell is actually one of the earliest symptoms that we find people are encountering. So respiratory symptoms, fever, cough, shortness of breath, and fatigue. And then number 2 is GI symptoms, or stomach symptoms, digestive symptoms. You still have the fever, you have some nausea. You have in just diffuse watery diarrhea. Not really much form stool, but just running through you, running through you, running through you. And number 4, you can have symptoms of changing in your sense of smell or a decrease in your sense of smell. So you like everybody is smelling the rotten egg or the dirty trash or the food that's spoiled in the refrigerator except for you. This symptom sometimes comes on well before you have had any fevers, well before you've had any chills, anything else. So if you find that your sense of smell is totally off and that's not something that's normal for you, be thinking about maybe I need to get tested for coronavirus. And the 5th new symptom that we have been seeing and just starting to hear about in the last week is sores on your feet. So you can have sores on your feet. You can have these red, itchy sores on your feet. So now there's a question. A lot of dermatologists are looking into this. Is the coronavirus being spread through the soles of your feet, your shoes? So make sure when you get home, you spraying your shoes off. You're leaving your shoes in the garage, spraying them. I guess inside and out now, because we at my house, we just been spraying them on the outside. If you're leaving comments, I can't see any comments today. Or y'all just quiet. Y'all just quiet today? Anyway, so let's review. We said respiratory symptoms was what everybody's talking about, right? That's fever, that's chills, that's fatigue, that's cough, that's shortness of breath first. Number 2 is digestive symptoms. So those digestive symptoms that you can have is fever. Okay, now I'm seeing your comments, guys. I wasn't able to see anything. I wasn't being rude. Welcome to the Dr. Kre and Me show. So the next symptom is digestive symptoms. You have that fever. It can be low grade on up. And then you will have diffuse watery diarrhea, whether you've eaten anything bad or not. The concern with the digestive symptoms is you can have problems with becoming dehydrated. So if you get dehydrated, then we start a whole nother downhill spiral. Hey y'all, thank y'all for joining. So be mindful that even if you're really not that hungry, you need to be eating something with nutrients, chicken noodle soup, some green vegetables, something. Nourish yourself, right? And stay hydrated. So 1 is respiratory symptoms. 2 is digestive symptoms. Number 3 is losing your sense of smell, right? So you can lose your sense of smell, and that's one of the very, very earliest signs that a lot of people may not think of is related to that, because you're like, oh, I didn't smell that skunk. It was a whole skunk, y'all. Okay? So losing the sense of smell. All right. And lastly, on the outpatient side, you can have problems with sores on your feet. Okay? There are these red, itchy sores on your toes. You're like, I hadn't been to the nail shop. Should nobody be going to the nail shop at this point. I haven't done anything else. I'm not done anything to my cuticles where it should be inflamed, infected, irritated, but I got all these sores on my feet, and they actually hurt. So some dermatologists are looking into the fact that this could be another sign of coronavirus. So what should send you to the hospital? Of these symptoms, if you're for respiratory, if you are starting to have shortness of breath, or if by chance you have oxygen saturation, where you check your oxygen on your hand and your oxygen level is less than about 91%, then those are reasons for you to get to the ER, because you may need some supplemental oxygen. And remember, before we talked about just not running to the ER. Don't just run to the ER. Don't just run off to the ER, right? For the digestive symptoms, if you get dehydrated, if you're not ingesting well, you may need to go to the hospital so you can get IV fluids so that you can get your nourishment through that way. But we want you to continue to eat no matter what symptoms you have. Eat. Bland foods, but eat. Eat chicken noodle soup, Like I said, green leafy vegetables, the pot liquor from the soup, the pot liquor from the greens. However you can get it, make sure that you're eating, okay? And the sense of smell, making sure that you're paying attention to your family. Oh my goodness, I did not smell that. That can be a problem. And your feet, you can have these new lesions on your feet without any just cause, right? So, all right, so the new lesions on your feet. So the concern is a lot of doctors, a lot of us outpatient doctors are not seeing patients up in person. If you have new lesions on your feet, then try and do a video call with your doctor and take the camera, show them your feet. A lot of doctors aren't necessarily taking new patients at this time. So hopefully you guys been kicking it with Dr. Kre a long time, and you know the importance of having a primary care physician. I hope you have a primary care doctor so that they can look at your feet. A lot of the other things you can kind of describe, any of these symptoms you can describe, and they would say, okay, those are symptoms of coronavirus. You likely need to be tested. So we talked about respiratory, digestive symptoms. I can't smell, Dr. Kre. The lesions on your feet. So say for instance you get admitted, right? You're like, okay, I'm down, I'm low, I'm out. What else can coronavirus do to me, Dr. Kre? So coronavirus, of course, it attacks your lungs. If your oxygen saturation level is less than 90%, you have to be put on supplemental oxygen. The oxygen can only go up so much. After that, they put you on they may be an open face mask. They may put you on a non-rebreather. They will transition you through the breathing methods where you can get oxygen. And then if you have to, they will put you on a ventilator or a breathing machine. And that's where they kind of relax you down and allow the oxygen to get to your lungs, because you're not able to oxygenate and get your oxygen to yourself like you should without the assistance. And all the other levels have not been adequate. All right? So if you end up in an ICU, or if your loved one ends up in an ICU on a ventilator, a lot of them are being placed on a ventilator. When you go in the hospital, you're used to people laying in the bed like this. This is what we call in medicine supine. But they're putting them on a machine and laying them on their stomach. If you have symptoms and you have to be treated at home, they say, oh, you don't meet admission criteria, you don't need to be admitted, go home, but you're coughing a lot, your breathing is labored, you feel short of breath, lay on your stomach. Okay? Something about this virus and oxygenation, if you lay what we call in medicine prone, so you lay on your stomach and then you're able to transmit your oxygen, you can breathe better. So in ICU settings, guys, they are laying people on their stomach. So if you could get in there to see your loved one, they wouldn't be laying up in the bed like this. They would essentially be laying in the bed on their stomach. So, which is very different than what we used to seeing, right? So thank y'all for joining. For those of you that are late, we talked about the symptoms that you can have by system. You can have respiratory symptoms. That's all everybody's talking about right now, right? Respiratory, a fever greater than 100.4. Coughing, that's new to you. Shortness of breath, wheezing, and fatigue. Those are those that can progress and get you to the ventilator. 2, if you have digestive symptoms, that would be the appetite change and decrease in your taste, and it's diffuse watery diarrhea for no reason at all. You didn't eat bad, you didn't eat out, then that you have to be concerned for dehydration. So make sure you're putting something in your mouth, that being liquids, that being food, that being pot liquor from the vegetables, that being chicken noodle soup. Thirdly, your sense of smell is off, so that makes you not want to feel like you want to eat, right? And then the sores on your feet. That's new. That's new too, that we're learning about. So if you get into the hospital, we're also finding that the coronavirus not only attacks your lungs, we see the progression where people begin to get better. Then about day 8 or 9, they're weaned off of their oxygen songs. Oh, they're not requiring as much oxygen. Then all of a sudden, their heart stops. because the virus attacks the outside of the heart, and they get what's called myocarditis, or inflammation of the heart, and then their heart just stop. Like no true warning in that. So a lot of people are like, oh my gosh, do I need to be trying to get these medicines that you hear the president talking about, the zithromycin and the chloroquinolone? Those two medicines together can cause your heart to be in a crazy rhythm, and can cause you to have arrhythmias, irregular heartbeat, and your heart can stop from that. And on top of that, the virus is doing its thing and causing your heart to not want to work on its own as well. So just be mindful of that. So inside of the hospital, you have to worry about the lungs not working, you being ending up being on a ventilator or the breathing machine. Your heart just flat out stop working because the virus can attack the heart. And lastly, you can worry about your kidneys not working, because the kidneys have certain receptors that the coronavirus is being more prone to. So a lot of those people are ending up on dialysis. Well, as your kidney works to filter, the bad things out. But we need the kidneys to help you hydrate, to be hydrated. Kidneys need to be hydrated. Well, if you have GI symptoms and you don't feel like eating and you don't feel like drinking, you're doing a disservice to your kidneys as well. And a lot of African American people, we already have problems with kidneys. We already have a kidney function that's a little bit shaky because of your long-standing history of diabetes, because of your long-standing history with high blood pressure. Those things, that makes for the perfect storm for people to get in there and die, because your kidneys are already weak. Your heart is already tired from working overtime because you've had high blood pressure for so long, because you may not take that medicine like the doctor said. Doctor don't know. They want me to be on 5 medicines, but I'm just going to take this one. And that makes your heart work overtime. So imagine a heart that's been worked overtime, and then you add a virus in there that your body's not used to being fought off. So your body's like, so what are we supposed to do with that now? How can we deal with high blood pressure as well as dealing with the heart, the heart already being attacked? So you just have to be mindful of those things. So be mindful that, yes, it can attack your respiratory symptoms. Yes, it can attack your digestion. It will attack your sense of smell. It can attack your skin. But it also can affect your heart, and it also can affect your kidneys, and cause these symptoms, these body systems, to shut completely down. So be mindful, guys, that that's the kind of the progression that we're seeing with coronavirus. If you get short of breath and they're telling you to deal with it at home, you're having some coughing, as much as you can, lay on your stomach. That helps you to get your breathing better. And the last thing I wanted to talk to you guys about was what happens, Dr. Kre, if I've had some of these symptoms. I've gone and gotten tested, and my test was negative, but I'm pretty sure that I still have these symptoms, and I'm pretty sure that my flu was negative, my strep was negative, my labs look okay. You can still have coronavirus with a negative test. The tests are 30. There's a 30% chance at least that your test is a false negative. Okay, guys. So treat the body. We don't treat what the test result says. We treat what's happening in your body. So yes, if you're negative, but you're like, oh gosh, Dr. Kre, I know something still is not right, then use your intuition. It's usually never wrong, right? So use your intuition and say, well, I'm going to still self-quarantine. I'm going to still isolate. Remember last week we talked about there was a difference. Self-quarantine is we're all in fellowship together. Isolating is where I'm in a room in my house, if possible, and I got my own bathroom. That's not possible for everybody. Everybody don't have a house with more than one bathroom. But because you could be shedding the disease, shedding the virus, like we said, by way of respiratory. So that's blowing your nose, that's sneezing, that's spitting when you brush your teeth, that's wiping your eyes and wiping it on your face or touching your kids. So you're shedding it that way, which you do that in the bathroom. And if you have GI symptoms of diarrhea and you're running off, that's another way you can be spreading it to your family. Okay? And if you're walking on the floor barefoot and you got sores on your feet, hey, guys, that's another way you can be spreading it to your family. So it's not enough to just be quarantined to your house. If you're symptomatic, while you wait on your test to come back, even if your test is negative, you need to be isolated from your family. Your family needs to be wearing their mask, even if they're not around you, because all your cooties have been in that atmosphere, okay? So they need to be wearing their mask. They need to be wearing socks and shoes on their feet. If someone in the house has been exposed and they're waiting on their test, don't act like you're negative and you don't know, because you can just continue to spread the virus, okay? I hope that's been helpful, guys. So know that the symptoms and this virus and this disease affects more than the respiratory. Respiratory symptoms can lead to being on a ventilator, and the heart can stop because the heart can get inflamed, the heart can get attacked. Your kidneys can stop. You can be on dialysis, and that will cause your kidneys to stop working. You can get dehydrated, and that leads to your kidneys being aggravated again. So be mindful, guys. Take care of each other. And if you're going out, yes, wear your mask. We talked about that last time. If you didn't see the video last time with us talking about wearing your mask, putting a coffee filter in there if it's not a medical grade mask, so you can protect yourself and from others. And I can keep my germs to myself. You can keep your germs to yourself. Well, thanks so much for joining us this day for the latest edition of the Dr. Kre and Me show. I'll be back next Tuesday at 2 p.m. with some new updates. And we'll be talking about coronavirus as long as we need to be talking about it. After that, we'll go back to something fun. So make sure to like and share and share and share, okay? You can find me on all social media platforms at Dr. Kre, spell Dr. out, DOCTORKRE. Again, it is Dr. Kre. I'm a board-certified family medicine physician, and I specialize in helping everyday people learn to live healthier, happier, whole lives. I feel it's my job to be able to tell you what you need to know and to decipher all that jargon that they're talking about all around you. Because I feel like when you know better, you can do better. So I charge you today with doing better, okay? Take care.